The blepharoplasty is an operation that aims to reshape, remove excess skin and or fat from both the upper and or lower eyelids. It is a great operation. It is possible to do the uppers, the lowers, either as separate procedures or as a combined procedure. In the upper eyelids, the indication for surgery is an excess of skin that interferes with vision. Classically, the eyelids restrict the visual access, and people can see the skin drooping over their eyelids, particularly at the end of the day. This can be performed in combination with removal of fat, classically the inner fat pad in the inner part of the eye. It is a great operation. For any aesthetic operation, it gives the biggest bang for your buck, because when patients look at you, they tend to look at the triangle and they concentrate on the eyes. So some patients can have a blepharoplasty in combination with a facelift, and people notice the blepharoplasty more than the facelift, which is a more extensive and unfortunately more expensive operation. It has a very low complication rate and a very high patient satisfaction rate. Most patients get almost 95 to 100% satisfaction from the upper eyelids. The lower eyelids doesn't deliver quite as much as the upper eyelids. Most patients will probably only get 70% of their desired outcome. The reason for that is because of the anatomy and technical limitations. You've got to be very, very careful removing the lower eyelid skin, because if it's not done by a board-certified plastic surgeon, it is possible for the skin to contract and pull down, causing what we call an ectropion. For that reason, whenever an eyelid surgery is performed, in addition to removing skin, in extreme cases some fat, it is important that a reconstructive procedure is performed whereby the strength of the lower eyelid is reinforced, classically with a canthopexy, which is where the lower eyelid tissues are actually reinforced and hitched to the outer part of the bone of the eye. For that reason, lower eyelid surgery is more commonly done under a general anaesthetic. It is possible to do it under a local anaesthetic, but it's not as well tolerated. In my practice, approximately 90% of patients having the upper eyelids operated on prefer to have it done under locals, because it's a much easier procedure to perform under local anaesthetic in most patients. So lower eyelids tend to be under a full general anaesthetic, whereas upper eyelids in most patients is under a local anaesthetic day case procedure.